Hey, so I'm trying to remember what I updated in a short and what I left for y'all in my last long form video. Um, so I had my CAT scan done at the hospital, and I went home, and my symptoms kept getting worse, and I had an appointment set to see the pulmonologist today, actually, but we ended up getting bad weather and got snowed in, and so they canceled. They had to close the clinic because not enough people could get to the hospital safely, and they told me that if I'm symptomatic, call the ER and get picked up, which is what I ended up doing, because the only reason I wasn't in a hospital before now, hadn't gone to the ER before now, was because I was trying to hold out for that pulmonology appointment. Ariel tried to get our car out, but we couldn't make it over the first hill of snow right out of our driveway, so I did have to end up calling an ambulance, and since we don't know when it's going to be safe for her to drive, she stayed home so she could continue to work and do whatnot and not be trapped at the hospital for an indefinite period, because they're saying we're supposed to get more bad weather here soon. So, and she's normally here with me for every medical thing that I have had done in the last almost 16 years now. So it's a little weird, but she's okay at home with Yana, and I'm okay here. So it'll be okay. They did some tests. They did blood work. Not sure exactly what, but they did blood work. They did an arterial stick, and that's usually to check for oxygenation in like the circulatory system. They did an x-ray. They did another CT scan. This one had contrast in it, so they can see things moving around better. They did a sputum test. They did another COVID and flu test, which was negative. I think that's all the tests they did. But they have also been giving me breathing treatments. They gave me steroids, antibiotics, medicine for like acid reflux, nausea, and then my normal and a blood thinner, and then my normal meds that I take. So I am admitted to the hospital, and I'll be here for, I don't know, at least a couple days, I think. I'll try to update as I can. Oh, I did forget to mention that my oxygen sats were at 76 when the ER picked me up, or the ambulance picked me up. But the supplemental oxygen has been helping it pretty good stay up, especially at rest, so that's good. And after they pumped me full of medicines, one of them was a shot into my stomach. Some were IV meds and some were just regular oral meds. After all that, I threw up on the way to go upstairs to be admitted. So that was fun. But I think it was just having all the meds on me all of a sudden and on an empty stomach, because I hadn't been able to eat all day, because I literally got up, came here, they told me not to eat, and they just let me have a sandwich. They sent some chips and applesauce and stuff too, but I didn't have time to eat anything but the sandwich before they wanted me off of food again, because I'm supposed to see the pulmonologist in the morning, and he might order some more tests that I will need to be clear for.